Let's say a company developed a test called TestX, and this company claims that this TestX is better in detecting cervical cancer in its early stage compared to Pap smear. And they give you concluding remark that our test is better. But when you reviewed the abstract of this article, you found that positive likelihood ratio of TestX is 2 versus 10 in Pap smear, and negative likelihood ratio of TestX is 0.8 compared to 0.1 of in Pap smear. So which test you think is better? Is TestX really better compared to Pap smear? No, because you can see positive likelihood ratio is greater in Pap smear and negative likelihood ratio is lower in Pap smear compared to TestX. So in both terms, Pap smear is better compared to TestX. What is positive likelihood ratio? Positive likelihood ratio is the likelihood of positive among diseased, likelihood of positive test among diseased versus likelihood of positive test among healthy populations. So as much as likelihood ratio is higher, it helps to rule in disease. So if you see both, positive likelihood ratio is higher for Pap smear, so Pap smear helps to rule in disease. If you see negative likelihood ratio, it is lower in Pap smear. So what is negative likelihood ratio? Negative likelihood ratio means negative test in diseased person compared to negative test in healthy population, right? Non-diseased populations. So as negative likelihood ratio is lower, it means it helps to rule out disease. So which test has lower negative likelihood ratio? Pap smear. So this test will help to rule out disease. That's why Pap smear is better compared to TestX in terms of both ruling in and ruling out disease. And about likelihood ratio, I would like to tell you that it does not depend upon the prevalence of disease. Let's suppose a community has prevalence of 10% of cervical cancer, another community has prevalence of 50% of cervical cancer. So this likelihood ratio of the test won't be affected with the prevalence of the disease, unlike the predictive value. Positive predictive value will be higher if prevalence of the disease is higher, negative predictive value will be lower if the prevalence of the disease is higher. Okay, so this widely fluctuates with the prevalence of the disease, the predictive value of the test, but this likelihood ratio does not fluctuate with the prevalence of the disease.